Welcome to the Bone and Joint Playbook with Dr. John Urse, where we explore an extensive range of orthopedic topics and insights. Our goal is to help you understand the available orthopedic options and treatments available, and hopefully give you some answers to questions you might have. We want to thank our following sponsors.
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted. Ted's is available online at tedsaladdressing.com.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Hey, Dr. John Urse, welcome back.
Good morning, Terry. How are you?
I'm good. Have you seen the sunshine out there today?
I have. It's 50 days a year in Dayton.
Is that what we get, 50?
That's why they put Wright Pat Air Force Base here, so the Russians couldn't spy on us from satellites because there's so much cloud cover.
Where did you get? Is that true?
Probably not. The weather's true. But
All right. So today we're going to talk about something that I can relate to, because this is something I think I've gotten wrong my whole life, and you're going to correct me. I have pain issues all the time, shoulders, knees, feet, whatever it is. I've done something, I've hurt something, I take 2 Tylenol, I wait for it to kick in, and I follow the directions. I don't take anything else, I don't do anything else. You're telling us this could be wrong.
yes, and you're not the only person who's underutilizing things that are available to them. So today we're going to talk about multimodal pain control.
Multimodal. Modal means what?
Different ways to control pain with more than one thing. So instead of saying I only use Tylenol, well, Tylenol's good. It's a non-narcotic pain reliever.
Yeah.
It blocks an inflammation pathway called a COX-3 receptor pathway, which isn't important, except things like anti-inflammatories, we've heard of non-steroidals called NSAIDs, they block some of the other inflammation pathways. So now you're blocking 2 things causing inflammation and discomfort from a swollen knee or a headache or whatever. So multimodal is a way to attack pain or a problem from different angles. Let's say you've got burning down your leg. We talked about sciatic nerve pain from your back, and that burning numbness down the leg can be a sciatic nerve flare-up. Well, there are nerve medicines. So you could take an anti-inflammatory medicine like Aleve, Advil, or any of the numerous non-steroidals. You could take Tylenol, which is acetaminophen. That's another non-narcotic pain medicine. You may add a nerve pill. There's things like gabapentin and Lyrica.
I take gabapentin.
Right. So these medicines aren't to be done. You know, some of them are prescriptions, some are over the counter. We're going to want to run all these decisions by our healthcare provider, especially if you're on other medicines. You may be on blood thinners, you may be on heart medications. Yeah. So you want to say, hey, I just heard this podcast and I'm going to start, putting all my jelly beans in a basket and start taking a bunch of them. Well, the answer is to do the research. If it's over the counter, it doesn't need a doctor to tell you can take it. But what you want to do is look at different categories of how medicines work. You don't want to take Coke with Pepsi, like 2 non-steroidals. You wouldn't take Motrin with Aleve because they both do the same thing. You can get ulcers. We talked about kidney problems. There are side effects to medicines, but you can take different categories of medicine. One for pain that works in the head, inflammation medicines like non-steroidals work in the body where your swollen knee is or where inflammation is.
Well, can we start in the more simple, simplistic way for guys like me? Tell me, you go to the
pharmacy,
pharmacy, whatever, and there's pain medications. Which ones would you suggest are the most effective for certain things? Let's go with, I hurt my knee, it's red, it's swelling. Which pain medicine do I take?
Well, first of all, red and swelling means inflammation. So an anti-inflammatory would be a good choice, something like Aleve or Advil, ibuprofen. There are 20 of these out there. Now, those, again, are in lower strength, non-prescription, but what you want to know is like, how much can I take to be effective. You took 2 Tylenol, and I'd say, how many milligrams, Terry? Because the maximum dose of acetaminophen, which is Tylenol, is 4,000 milligrams a day. And you're like, well, I'm only taking 500. Well, you're taking 1/8 of a dose, and that's why you're still hurting. So you can take 1,000 milligrams of acetaminophen every 6 hours.
What?
And
Really?
that's
I can take more than. I thought we're supposed to follow the directions.
the directions will tell you. Yeah, you can take this many of these every 6 hours, 8 hours. Again, before you take any medicine, check with your doctor. Make sure you don't have an ulcer. You don't want to take Motrin if you're on blood thinners. You don't want to take Motrin if you have a bleeding ulcer in your stomach or a kidney problem. So there are reasons even an over-the-counter medicine may not be good for you.
Can I ask? Let me pause you again. I'm sorry to interrupt, but my theory is you always say everybody that sits in this chair or these chairs always says talk to your doctor. If I pick up the phone and call the doctor's office, I'm not talking to the doctor. I'm talking to some receptionist who says, what's your name? We'll get back to you, right? And then they get back to you, and then you ask the question. They say, I'll get back to you again because they got to talk to you.
Well, again, it's an important thing when you start interacting with medicines you may already be on. You know, if your doctor has given you a blood thinner and you say, hey, I think I need ibuprofen for my headache, he may say or she may say, this is not the best thing for you while you're on a blood thinner. So you could Google it. You could ask your pharmacist.
Okay, Google.
You know, you can look at AI. You can look at the different AI applications. So there are things where you just say, "Can I take this with that?" And you'll get an answer faster than your doctor's office. What I'm saying is that these are trends that you should develop as you go through life with you and your family. Like if I need Advil and Tylenol, those are okay to take together in the absence of ulcers or problems. And then how much Advil can you take? Well, you can take 2,400 milligrams of Advil a day, which is ibuprofen.
Yeah.
So you take they're 200 milligrams. They give them in small doses because people eat them like M&Ms because I got a bad headache. I'm going to take a handful of these. Well, they don't want you to kill yourself or shut your kidneys down. So, you may need to take 2 to 4 every 8 hours. So, as long as you don't get over 2,400 milligrams a day of ibuprofen, which is Advil or some of the
so that's
that
the
brand.
thing that I think they don't know and I didn't know, that I can take more than what the bottle says.
No, I didn't say that. The bottle's telling you to take 2 every 4 hours. Well, that's 6 doses a day, right? So you can take, and you can do the math any way you want. You can take 600 milligrams 4 times a day. You can take 800 milligrams 3 times a day. Whatever you do to get to 2,400 is the most you should take.
Okay.
I'm never going to tell you to take more than you can Google how much acetaminophen is safe on a daily basis.
Right.
Well, the answer should be 4,000 milligrams a day, whether it's in 500 milligrams or 1,000. Most people take too small a dose. They therefore don't get the effect they want. And what we're trying to do is we're trying to come at the body with some modalities that are going to complement each other. So multimodal just means we're going to try this medicine with this one. We may add ice for your sore knee. We may add elevation, compression.
Right.
You may add, like some breathing treatment. You may put on a little ocean wave thing on your TV and just chill out. Put your foot up in the air and, you just twisted your ankle and, it doesn't need anything but elevation, ice, and some maybe some anti-inflammatories. You could take some Tylenol with it. We're trying to use the idea that you're blocking different pathways. We're trying to minimize opioid use. So opioids are narcotics.
Sure.
It doesn't mean you can't take an opioid. You may have a surgery where your doctor gives you pain medicines, and those are for what we call breakthrough pain. If you're in pain, it's because they just fixed your rotator cuff or did your knee replacement, or you had an ankle fracture that they fixed. Take your pills. They're there for you.
Be addicted to it.
Well, you're not going to become addicted in most cases. Anybody can become addicted to anything if they take too much of it, or you have that tendency of addiction. And It can be alcohol, it can be drugs, it can be anything that we somehow didn't expect, but we've overdone it a little. So that's a whole nother talk on addiction.
All right, so
what you don't want to do is sit at home and writhe in pain because you're like, oh, I've heard of how bad this pain medicine is. It's like, if you need it, you need to take it. We see women going through childbirth naturally, and then when the babies come, they're like grabbing you, going, "I need some drugs." Like, that's because it hurts. Like, it's okay. Your baby's totally formed by then. It's coming out. You're not going to lose a finger on this deal.
So let me ask a question related to this. I hurt my knee. It's getting red. It's getting swollen. Would you suggest starting with a max dose I could take, and then because eventually over time it's going to start to subside?
Yeah, I'm big on maxing doses out. Okay, so if you're going to take, let's say, Aleve, which is another anti-inflammatory, you can take 2 of those every 12 hours, and that's close. The prescription strength is 500 twice a day, so 2 of the 220s is 440. You could take, you want to take a maximum dose to get a maximum benefit. That's the safe dose. And people, I think, just don't know. And you're not trained in pharmacology, but your pharmacist will answer the question. Your internet will answer the question. Your neighbor will always answer the question. Then he'll actually steal your drugs out of your cabinet. So, what you want to do is just realize you're going to go through simple things first. Tylenol, anti-inflammatories, ice, and then, maybe a nerve medicine, maybe a muscle relaxant, things that are attacking the body's problems in different ways. Then it's like, gosh, I've got a few pain pills that I just might need if I can't sleep and my leg's throbbing and I'm going to jump off a cliff. I'd say, don't jump, take a pain pill. And remember, if 2 pills would kill you, they won't let you take 1. So, sometimes your doctor will say 1 or 2 every 6 to 8 hours. Again, there is a safety margin built into medicines. They don't want people I got that. Holy cow. I mean, so just, you'll know your body. My wife is great with just 2 Advil. She doesn't need any more than that. She could take more, doesn't need it. I'm not trying to plug Advil. Maybe they'll sponsor us.
So the categories, again, if you could just walk me through the 3 categories, is it ibuprofen?
Anti-inflammatories includes ibuprofen, Celebrex, Motrin, Mobic, Aleve. All those there's 20 of them, and they are basically different.
Are they the same thing?
They all work in the same pathways. Some of them have different chemical compounds. And so, like, if you're on, some of these are, for instance, like Motrin is a propionic acid. That type of medicine is similar to naproxen, which is Aleve, and that's similar to a thing called NSAID. And so if you've taken one in that category, you should switch over to something like Celebrex or Voltaren or a different, they call them acetic acids. Those are different types
those
of.
Those aren't over the counter.
They're
right?
Some of the anti-inflammatories are over the counter. Aleve is over the counter.
Yeah,
Advil's over the counter.
So Tylenol and Aleve are different things.
Tylenol is not an anti-inflammatory. It's a pain medicine. It helps with fever and helps with pain. It's very safe. It can be harmful if you've got a bad liver, but normally, as long as if you had to pick one pain medicine that's the safe for you and grandma, it's Tylenol. And Tylenol is a great medicine. You can take, like, as I said, like 1,000 milligrams every 8 to 12 hours. And really the max on it's 4,000 a day. So there is sometimes Tylenol in the pain medicine. So if you take something like Percocet or Vicodin, they have like 350 milligrams of acetaminophen in them. You have to add that to your daily total if you're taking any other pain meds with Tylenol. So, you just have to. But
what I'm hearing you say, where we got around to it, is I can take a Tylenol, and I can also take an Aleve.
Yes, please do.
There's nothing stopping me from doing those. Those two are not.
Abs. They work. Yeah, they work in different paths. So multimodal means you're working in different ways to control pain.
Okay.
Again, a muscle relaxant may help the spasm in your hip, I'm not great on muscle relaxants. They somewhat make people tired. There aren't really very many benefits to them, although people use them. There are nerve medicines. We talked about the gabapentin and some of the pregabalin things that are they're meant for nerve pain, and they really only do that. They're not narcotics. There are non-medical modalities. We talked about topical ointments or patches that have Novocaine. There are, we went through some of those what are called therapeutic modalities. Remember that?
Yep.
And so, what you want to do is, go to the barbershop or golf course and see what Bob and Betty are doing for their problem. And, there are some things like CBD creams and oils.
Do those work?
Those are useful. Remember the medical marijuana talk is a whole nother podcast we'll do.
Oh yeah.
And it's really the THC component of marijuana is the more pain beneficial portion than the CBD part. CBD is more readily available. I don't think it does as much. There are some drop forms of the THC. There are physicians who are medical marijuana licensed prescribers, and they really know the dosing. They know the proper amounts. Most states, it's legal for medical marijuana in the United States, at least. So again, I think there are a lot of safe alternatives. There are some that are different. There's a whole nother type of microdosing now coming out with some of these medical mushrooms and psychedelics and treating post-traumatic stress things.
Like I need to play some music behind this one.
Yeah, you could put on some Jefferson Airplane.
Yeah.
Some
So
White Rabbit or something.
Is there anything we've left off? Because I want to make sure we've hit the high points on this stuff.
Well, I think again, what you want to do is realize that we want to start easy and simple with things that control your problem. And if ice and Tylenol and anti-inflammatories work, then combine those as a multimodal way to feel better. Then don't be afraid to step up. If your pain isn't better after a certain time, you may have to go to something, either a little more of one of those 2 or 3 things, or try something else for pain that you might need. And again, things like migraines for bad headaches, there are specific medicines for them that work. And, you may want to see a neurologist or a migraine or a headache specialist for different types of pain problems. There are pain management doctors who manage pain with different modalities. Some use medical marijuana. Some use these gabapentin medications for nerve pain. Some of them there are new non-narcotic medicines. There's a thing called Jornvax that's a non-narcotic pain medicine. And somehow it's a non-opioid, so it's not addictive. It's new, so again, it isn't always covered by all insurances. But there's a huge area here, and I think you can scratch the surface. You can look at AI for information. You can talk to your pharmacist. This is a really good field, and it's very practical for everyday treating. I mean, your family, everybody has a problem at some point with something. You just may have a tooth extraction. Well, then check with your dentist. Is it okay to take an anti-inflammatory and a Tylenol? You may need an antibiotic with it because it's possibly infected. So there are things that can be taken together. The simple answer is always, you can check the internet to say, can I take this with that? It'll tell you, like, heck no, or go ahead.
All right, so let me end this with one final question, because I'm just so damn curious about this. You say, everybody says call your doctor, right? Talk to them. What does happen when I call my doctor? Tell me what goes on behind the scenes. Are they rushing back to you, knocking on the exam door, saying, hey, I got this guy on the phone? No. Or is there somebody in that office who answers?
They should triage calls. Unfortunately, there are doctors who are seeing patients. Their doctors aren't even there that day.
Yeah.
You may have a nurse practitioner or a physician assistant.
Okay.
And they are busy. So normally they'll get a list of the people who called. There are online questions you can do to some offices.
Yeah.
You write an email to Dr. Jones and say, hey, I need a call back at this number. I am Les Mis because I have all this pain, and you.
Les Mis.
It's a play. Yeah, I'm miserable. Yeah. Okay. So if you're miserable, you want to tell your doctor you're miserable, and you want to do something. Now, a lot of times they aren't going to just throw out a bunch of narcotics over the phone. They go, hey, you've got a terminal brain lesion that needs something. We're going to call something in. We know you. It's a legitimate call. I mean, it's something where communicate to your doctor or healthcare provider what's wrong. Tell them that you need a call back. Most of them will try to get back to you that day. And again, it's just, the healthcare system is being substituted with AI, just like the factory workers and robots. B, there's less providers. C, there's less physicians because they can pay somebody else a lesser salary. And the really good practices pay attention to what you just said. They call people back. They do customer service well. They give you that feeling like, hey, I'm important. Like, you called me back. It goes a long way.
It does go a long way.
And there's a trend toward concierge medicine too, where you pay a flat fee for a year to get an appointment immediately, or you text your doctor and go, hey, call me in some da-da-da. You know me. I'm miserable.
That's kind of what Dr. Paul's doing these days.
You can do those things, but they're self-pay, right? They utilize your insurance for things, but you have access to the doctor or his healthcare staff,
right,
like 24/7, but you pay for it.
All right. So, Hey, we want to thank y'all for joining us here again.
Can we thank our sponsors?
Oh my God, I always forget. By the way, what a cool hat.
Yeah, that's to keep the Beatles playing. We give them multimodal pain control, and that way they can sit up there for
I'm sure
12 hours in Hamburg
This podcast is
and
going
play
to get
away.
yanked off the air just because we showed a logo.
Well, there's no logo there. There's just a couple guys walking down
Four
Abbey,
guys walking across the
down
street.
Abbey Road.
That's right.
So I think we want to thank Ted's Authentic Salad Dressing. It's a Greek dressing. It's a marinade also for food. And we want to thank Stiefel GWR Group, their financial planners. We appreciate their sponsorship. We like Tri-Level Recordings, who do the yes, they do a great job with our podcast. Be sure to like us on any social media venue you use, whether it be video on YouTube or some of the Spotify, iHeartRadio, Apple podcast sites.
All right. Well, hey, thanks again for joining us. We'll be back again in a couple of weeks with another episode of the Bone and Joint Playbook with this guy right here, Dr. John Urse. Thanks for joining us.
Thanks, Harry.
Bye.